The VA Life-Sustaining Treatment Decisions Initiative, or LSTDI, is a national quality improvement initiative to promote personalized, proactive, patient-driven care for veterans with serious illness. And the outcomes that are desired are to elicit, document, and honor these goals of care. Unfortunately, conversations about goals of care and life-sustaining treatment decisions are often initiated too late after a medical crisis or loss of decision-making capacity. It's also difficult to locate CPRS documentation about goals of care and LST decisions. And currently, VA orders pertaining to life-sustaining treatment decisions are limited to CPR, without orders to reflect decisions on feeding tubes, mechanical ventilation, and others. The LSTDI is a national quality improvement effort to address these concerns and has created a new templated progress note, as well as an order set and extensive training and tools. High-risk patients, or those that should have proactive goals of care conversations and documentation, are those that are at risk for a life-threatening clinical event within the next 1 to 2 years. And ideally, these conversations would occur prior to a medical crisis and in the outpatient setting whenever possible. Patients can be identified through clinical judgment and objective screening tools like the CAN score in primary care. Or any patient who expresses the desire to limit life-sustaining treatment should have these conversations as well. Many different types of healthcare providers can confirm the LST plan with a veteran and write appropriate progress notes and orders, including physicians, residents, advanced practice providers, and physician assistants. The LST orders found in CPRS cover more topics than just CPR, as can be seen here. The life-sustaining treatment orders will automatically populate at the top of the list of CPRS orders on the Orders tab in the default view. These orders can be written for patients in any care setting, and they are durable in that they do not auto-discontinue when a patient changes location of care, for example, between inpatient and outpatient. They will follow the patient through the entire healthcare journey. To launch a life-sustaining treatment decisions note, please go to the Notes tab and click New Note. Type life-sustaining treatment and choose the third option here, life-sustaining treatment, as the note title. Click OK. This will open a templated progress note that you can use to document a veteran's goals of care. For each question, you will see a Help Me box, which, if clicked, will give you further information about that particular question. You can click again to minimize this information. Fill out each question. For instance, decision-making capacity. The patient has capacity to make decisions about life-sustaining treatment options. Here you see we are filling out the person authorized under VA policy to make decisions for the patient if or when the patient loses decision-making capacity. In this example, there are no advance directive or state-authorized portable orders for this veteran. The patient does have understanding that is consistent with the medical facts. Number 5 indicates documentation of the patient's goals of care in his or her own words. Here we are indicating that the veteran would like to witness his grandson's high school graduation. Number 6 identifies the current plan for the use of life-sustaining treatments, which could include full scope of treatment or limitations of life-sustaining treatments. And in this example, we are choosing no invasive mechanical ventilation. The next section identifies cardiopulmonary resuscitation in the event of a cardiopulmonary arrest, and we have chosen DNAR. Number 7 indicates who participated in this discussion. And finally, number 8 indicates who has given oral informed consent for the life-sustaining treatment plan. As you finish the note, it will prompt you, and notice on the right-hand side of the screen there are selected orders that are being automatically populated. This includes the DNAR order and the no invasive mechanical ventilation order we identified previously. Sign the note, and it will be found on the left side under All Signed Notes with the note title Life-Sustaining Treatment. In an urgent or emergent medical situation, the source of truth for code status for any veteran is in CPRS under the Orders tab. Healthcare providers should look there first in any emergency. While there is space on the templated progress note for full code, there is no full code order. Therefore, no DNAR order equals full code, and no life-sustaining treatment orders of any kind equals full code. If there is a change in the veteran's wishes or goals of care, for example, the veteran would like to reverse her code status from DNAR to full code for a procedure, there are two options. Number 1, enter a new templated LST progress note that will automatically populate appropriate orders. Note that the previous orders will not automatically discontinue, so these must be discontinued in CPRS on the Orders tab. For example, you must discontinue the DNAR order. Number 2, create an addendum to the existing LST progress note outlining the veteran's updated wishes. Note that you must still discontinue obsolete orders and/or write new appropriate orders in CPRS on the Orders tab. For example, discontinue the DNAR order. This process of adjusting orders will need to be repeated once the reason for the temporary change in wishes is complete. For example, the surgical procedure.